Yes. So we'll start the topic for today. Is the screen visible?
Yes, sir. It is visible.
Okay. Good afternoon. So the topic for today is orthopedic appliances. And myself, Dr. Yatish Kumar Joshi from Department of Orthopedics, I will be presenting this topic. So what will you learn today? Today in this lecture, I will be covering what are orthopedic appliances, need to use orthopedic appliances, basic principles of working of orthopedic appliances, headgears, reversible headgear or face mask, headgear with chin cup, then we will come to conclusions. Okay, so what are orthopedic appliances? Does anyone know what are orthopedic appliances?
The appliances which are used in when um, for measurement of bone. No.
Okay, orthopedic appliances are extraoral appliances which apply heavy forces. So extraoral appliances means they gain anchorage from extraoral side, either the neck or the cranium bone, maybe the occipital bone or the frontal bone. They apply heavier forces. This means normal orthodontic forces range in grams of 25 to 100 or 150 grams. But orthopedic forces are heavy forces. They are measured in pounds or ounces. Pound is approximately 450 grams, that is approximately half a kg. So orthopedic appliances are extraoral appliances that apply heavy forces. Am I audible?
Yes, sir.
See, I don't want this lecture to be like a normal lecture. I would prefer all of you to unmute yourself so we can have a conversation.
Okay.
Okay, so extraoral appliances that apply heavy forces to promote growth of jaws or to restrict the growth of jaws or to redirect the growth of jaws. So to promote, restrict or redirect the growth of jaws in sagittal, vertical and horizontal planes. So I will explain once again. Orthopedic appliances are extraoral appliances which apply heavy forces to promote growth of jaws or restrict growth of jaws or redirect growth of jaws in sagittal, vertical and horizontal planes. So why do we need to use these appliances? So understanding the jaws, that is maxilla and mandible, are usually measured in terms of cranial size. So the size and the position of jaws may be normal, smaller or larger, or they may be positioned normally, forwardly or backwardly. So we need to find out first. First we find out abnormalities in size. Then we find out abnormalities in position. We check if there is any combination of abnormalities in size and position. All of these abnormalities of size and positions, after we have found out, we need one more important factor, that is growth. If growth is not present, then the orthopedic appliances do not work because they promote, restrict and redirect growth of jaws. If growth has completed, then there is no use of orthopedic appliances. They only work during the growth periods. So in the growth periods, if the size and position of jaws are abnormal, that means abnormalities in size like larger mandible, smaller mandible, larger maxilla, smaller maxilla, forwardly or backwardly positioned maxilla or mandible. So combination of these abnormalities are present, then we need to use them. But it is important that the growth is still remaining. If the growth is not remaining, then we cannot use these orthopedic appliances. So how do you diagnose the problems of jaws for which you need to use orthopedic appliances? So you can see this photograph. Can anyone tell me what is the problem in this photograph?
Mandela is too retrographic, maybe.
Yes, mandible looks smaller or retrographic. Good. Anything else?
Teeth are forwardly placed somewhat.
Okay, the teeth looks more evident or more visibility of the tooth and gum is present. Very good. Anything else?
Jawline is so prominent in second picture.
Second picture is after the treatment. Now see, the difference is that both the photographs are of the same patient. The first photograph, which is present on the left side, is before treatment. The second one is after treatment. This patient is treated surgically. Okay, these are not the effects of orthopedic appliances. But to make you understand what are skeletal jaw abnormalities, I have put these photos. So if you can realize in the first photo, the vertical height of maxilla is increased. The mandible is rotated backward. The jawline is not prominent. Mandible looks retrognathic. Chin is not prominent. So this is a problem seen in class 2 basis. The mandible can be small or placed backward. Maxilla can be large or placed forward. Maxilla can be placed downward. Maxilla can be rotated forward and mandible can be rotated backward. These are the combinations of problems that can exist. Any single problem or combination of all these problems. This is class 3 basis. Can you realize? This is also the same patient before and after surgical orthodontics. But for you to understand the jaw size and cranial relationships, I have put this photograph. So in this photograph, the maxillary height is less. The maxilla is placed backward. The mandibular height is more and size is more and placed forward. If you can realize in the post-treatment photos, see the increase in height of maxilla, decrease in height of mandible, decrease in size of mandible. Can you make the differences? So these changes we can bring about when the patient is growing. If growth is remaining, you can prevent such growth from happening. You can prevent such growth from happening. For this, you need to use orthopedic appliances. So to diagnose, there are two methods. First is clinical and lateral cephalogram examination, in which you check for maxillary size, positions, and rotations, and mandibular size, positions, and rotations. So these needs to be checked in all the three planes of dimension, that is sagittally, vertically, and horizontally. That means the maxilla can be larger anterior posteriorly, vertically, or transversely. The position can be forwardly placed, backwardly placed, upwardly placed, downwardly placed, or asymmetrically placed. The rotation can be forwardly rotated or backwardly rotated. Similarly, in mandible. Second thing you need to check is growth status. The patient is in prepubertal growth spot, in the growth spot, or postpubertal growth. Once the growth is completed, you cannot use orthopedic appliances. The best result of orthopedic appliances when being used for maxilla are seen in prepubertal growth spot and growth spot time. For results of mandible, you need to give the appliances during the growth spot or postpubertal growth spot area time. Sorry, are you getting it?
Yes.
Okay. So, what is the principle of orthopedic appliances? Now, as you know, in orthodontics we apply force. So, when the force is applied, the force can either be applied at the center of a body in the line. So when this force is applied at center of the body in the line, the body moves in the same direction. Now this horizontal force, when applied at the center of the resistance or rotation, brings about bodily tooth movement. But when it is not applied in straight line, if it is applied in angular line, then it brings about horizontal as well as vertical movement. But in both the cases, the force is acting from the center of resistance. In this scenario, when the force is not acting at the center of resistance, it can be acting below the center of resistance or above the center of resistance. So in such scenario, when it is acting above the center of resistance, the body moves forward as well as rotates around the center of resistance. Similarly, if it is applied below the center of resistance, it moves forward as well as rotates along the center of resistance. Are you all present?
Yes, sir.
Only one girl is replying always. Are you the CR?
No, sir.
Other students, Nikita, Prajakta, Shweta, and Mayur, are you all present or have you kept your phone aside?
So present, sir.
Okay, you guys can on your video cameras also. So I will be more comfortable to teach you. Shall I continue? Okay. Second thing is moment of force. When a force is applied, which is not acting at the center of resistance, that time the body moves as well as a rotation takes place around the center of resistance. This rotation is called as moment. So force, which is the external load that causes movement of the body, movement, matlab body moves aside. Second is moment, M-O-M-E-N-T. First is M-O-V-E-N-T, movement. Second is M-O-N-T, movement, that is circular motion. So when it is not passing to the center of resistance, then movement takes place. Magnitude and direction of force. Higher the magnitude of force, higher the displacement of the body. Lesser the magnitude, lesser the displacement. Second is direction. Direction is this arrow. The arrow is the direction towards which the body will move. In the movement, there is magnitude and direction again. Magnitude is bigger the arrow, higher the movement. Direction is the tip of the arrow. When the arrow tip directs the movement. Now this is a stable picture. I will be explaining same thing with animation to you. Last thing is controlling this force and movement is part of orthodontics. That is a basic principle of orthodontics. Higher amount of movement you want, जितना ज़्यादा movement चाहिए उतना ज़्यादा force लगेगा और जितना ज़्यादा rotation चाहिए उतना ज़्यादा movement create करना होता है. So see this picture. That this is center of resistance. This is point of force application. Amount of force is 10 gram. The distance is 5 meter. So can anyone tell me how much will be the movement? The moment is product of distance into force, that is 10 into 5. It will be 50 grams, 50 newtons per meters. That is product of 10 into 5. The only problem in this picture is that when you apply a force from here of 10 Newton, the body will rotate like this, not like this shorter arrow, the bigger arrow. Do you understand the concept of moment?
Yes.
Yes, sir.
Now see, when the first image, when you apply the force at the center of resistance, the body moves. Do you get it?
Yes.
Second picture, the force is not being applied at the center, but it is being applied above the center. So when the pressure is applied, this body should move as well as it should generate a movement like this. But because the force is in horizontal line, the body moves horizontally. Do you get it? Similarly, when the force is applied below the center of resistance, it moves forward, but anti-clockwise movement is generated. This is called as clockwise. This is called as anti-clockwise. Pure force passing to center of resistance, force passing above the center of resistance, creating clockwise movement, force passing below the center of resistance, creating anti-clockwise movement. Now what happens when the force is not acting in a straight line? When the force is acting in a direction, the body moves in the same direction, forward and downward. Now this is a pure force which is acting through the center of resistance. That is why there is pure forward and downward movement. But if you want to bring about rotation, you need to change the line of force above the center of resistance or below the center of resistance. So when the force is above center of resistance, this body moves in the direction of force as well as generates a moment. Similarly, when it is below the center of resistance, it generates movement as well as moves in the line of resistance. So imagine this box to be maxilla. If you want to bring the maxilla forward, you need to apply the pressure at the center of resistance of maxilla, which is present in between the premolar roots. So when you apply the pressure at premolar roots, it moves forward. If it is applied above the premolar roots, it moves forward as well as rotates clockwise. That means it gives corrects open bite or it causes deep bite. The maxilla goes downward from anteriorly and upward from posteriorly. So if a patient is having anterior open bite, you can pull the maxilla ahead as well as rotate it. If they are having maxilla is downwardly placed, you can rotate it by passing the force below the center of resistance. Similarly, if the maxilla is small and you want to bring it forward and downward, you want the overall growth of maxilla. That time the force is angulated. We give a forwardly and downwardly directed force. So when forward and downwardly directed force is given, the maxilla grows forward and downward. And if you want the rotation of maxilla simultaneously, you give forward and downward force but above the center of resistance, which will create forward movement as well as forward rotation of maxilla. Similarly, if you want the mandible to go forward and rotate anti-clockwise, or if you want the maxilla to go forward and rotate anti-clockwise, you can control the direction and movement based upon your force application. So there are three types of orthopedic appliances. First one is headgear. This appliance which all these people are wearing a headgear. Here are the basic components of headgear are strap, force generating module, the face bow. The face bow is inserted in an intraoral component. The face bow attaches to the force module. The force module is attached to the head strap. So when you pull this force module and engage in the head strap, it pulls the face bow backside and pulls the maxilla upward. Similarly, now the direction of force is backward and upward. This is center of resistance. So what effect will take place in this first case? Center of resistance यहाँ पे है, force इस तरफ directed है. It is below the center of resistance. So in this case, there will be restriction of growth of maxilla. That means maxilla will exhibit backward and upward pressure. This will cause restriction of growth of maxilla, as well as because the force is passing below the center of resistance, it will create a clockwise movement. Similarly, in this case, there will not be any prevention of vertical growth of maxilla, but the horizontal growth of maxilla will be prevented because the force is directed horizontally. But because the force is below the center of resistance, it will lead to a clockwise rotation. Similarly, in this case, it is a combination pull headgear. It will bring about posterior and forward, backward and upward restriction of growth of maxilla. So headgear is the first type of appliance. It is used for restricting the growth of maxilla. When the maxilla is growing excessively, it is used for restricting. Maxilla can grow excessively in class 2 basis. Class 2 can be due to growth of maxilla or restricted growth of mandible. So if the maxilla is growing excessively, you control it or redirect its growth using a headgear. I will be showing a small video of headgear. See, the maxilla is forwardly placed, the mandible is small. In such cases, you strap up and you give a headgear. The headgear pulls the maxilla backward, the dentition backward. This happens only in case of growing patient. This is a cervical pull headgear. Sorry, occipital pull headgear. It brings about backward and upward movement. And this is a combination pull headgear. So there are three types of headgear: cervical pull headgear, occipital pull headgear, and combination pull headgear. Okay, coming back to the PPT. After headgear, the next appliance is reverse pull headgear. So the headgear restricts the growth of maxilla. That means maxilla is pulled backward. It can be used in cognitive maxillary cases. This is reverse pull headgear. It does the reverse of what headgear does. It is also called as face mask. What face mask does is it pulls the maxilla ahead. The previous appliance was pulling the maxilla backside. This is pulling the maxilla ahead. It is used in class 3 cases, cleft cases most commonly. So what it does is it pulls the maxilla forward. While the maxilla comes forward, it can be brought forward, purely forward or forward and downward, along with clockwise and anti-clockwise rotation. This has a chin cup and a forehead pad. This forehead and chin cup gain anchorage from these areas. This part or a horizontal arm is used to engage elastics. This elastics, the position of this elastics can be moved upward and downward to adjust the direction of the force. The amount of force can be altered by changing the elastics. Heavier elastics give heavier forces, and the center of resistance से ऊपर आएगा या नीचे आएगा, that can be decided by moving the level of this arm. In headgear, the same can be decided by moving the level of this outer bow upward or downward. If you take it upward, a force comes from this direction, then it will lead to backward and upward restriction as well as anti-clockwise. When it is going from downwards, it will lead to backward and upward restriction as well as clockwise rotation. Are you getting it?
Yes, sir.
So headgear and reverse pull headgear. Both of these, headgear and reverse pull headgear, are used for maxilla. Headgear is used to restrict the growth of maxilla. Reverse headgear, pull headgear is used to accelerate or increase the growth of maxilla. Now, now for mandible, for Now see, this is a video of face mask. Where the face mask is, there is some intraoral appliance to hold the jaw. Then the face mask is applied. The work of this face mask is to bring the maxilla forward. Face mask takes the anchorage from forehead and chin. There is an intraoral device which has hooks. These elastics are engaged in hooks and the face mask crossbar or the horizontal arm. Level of horizontal arm can be adjusted. So this is a horizontal arm. Level can be adjusted to redirect the force. So till now we saw headgear and reverse pull headgear. Both were for maxilla. The third one is chin cup. Chin cup is for mandible. Now the mandible can be small or large. So when the mandible is small, we need to grow the mandible. For that purpose, we use functional appliances, twin block, activator, bionator, etc. So, but if the mandible is large or it is excessively growing or forwardly positioned, then we use a chin cup with headgear. It has similarly three type of straps or a single strap with multiple levels of attachment. So when a chin cup is used, similarly like a headgear, it applies a backward pressure on mandible. So it prevents the growth of mandible in forward and downward direction. The level of the force can be altered based on selection of the appliances or directly by altering the point of application of the force generating module. So this is the force generating module. If it is applied from this side, it prevents the vertical growth of maxilla. If it is placed from back side, it prevents the horizontal growth of mandible. Sorry. Okay. So I will revise the whole chapter once. After the revision, I will be asking few questions to you. You will have to answer those. What are orthopedic appliances? External appliances which apply heavy force to promote, restrict, or redirect the growth of jaws in sagittal, vertical, and horizontal plane. Why do we need? Because the size and position of jaws are not normal always. There is abnormalities in size. That means maxilla can be big or small, mandible can be big or small. The positions can be abnormal. That is, mandible can be placed forward or backward. Maxilla can be placed forward or backward. Or there can be a combination of this. That means smaller mandible and larger maxilla, or larger maxilla and smaller mandible. All these problems, if the growth is present, then they can be controlled or altered using orthopedic appliances. So how do you diagnose whether the problem? Because only after the diagnosing the problem, you will be able to select the appliance. So you diagnose the problem based on clinical laterocephalogram examination and hand rest examination. Hand rest will decide whether the patient is growing or not. The patient is prepubertal or growth spot, maxillary changes can be brought about. If it is growth spot and postpubertal, mandibular changes can be brought about. So while checking, we have to check for maxilla size, position, and rotations. For mandible size, position, and rotations. It is important because if the maxilla is larger, you use headgear. If the maxilla is smaller, you use reversible headgear. If the mandible is smaller, you use functional appliances. If the mandible is larger, you use chin cup. This chapter does not cover functional appliances. It covers headgear, reversible headgear, and chin cup. So what is the basic principle? There is a center of resistance of a body. When the force is passing to the center of resistance, the body moves overall. If the force is directed horizontally, the body moves horizontally. If the force is not directed horizontally, the body moves in the direction of the force, that is forward and downward. That is force. Second is movement. Movement is when the force is not applied at the center of resistance, the body moves in the direction of force as well as generates a rotatory component that is called as moment of force. This moment of force is in line with the force and around the center of resistance. What is force? What is movement? Magnitude and direction of force. Magnitude and direction of movement. Magnitude of force higher, bigger the arrow, bigger the force, and the arrow indicates the direction of movement. We can control the force and movement as we discussed it, all the three appliances as well as the animation. While applying the force, we can decide we want to pass the force to the center of resistance above or below, because to the center of resistance will bring pure movement, above will bring movement as well as rotation, below will movement as well as rotation. Solving this puzzle, when the center of resistance is 5 meters away from the point of application of force and the force is 10 newtons, the resultant movement is the product of distance into force, that is 10 into 5. 50 is the movement generated. In this diagram, the arrow is given in wrong direction. The arrow should be like this, because if the force is passing like this, the movement will be generated like this. So these are the animation. Through the center, body moves. Above the center, body moves with clockwise. Below the center, body moves with anti-clockwise. When it is a not the straight line, it moves forward and downward. When it is above the center of resistance, forward and downward with clockwise motion. When it is below the center of resistance, forward and upward with anti-clockwise motion. This is headgear. Headgear can be of three types: parietal or high pull headgear, cervical pull headgear. It is occipital or combination pull headgear. The level of the force can be decided based upon the angulation of the external bow. जितना ऊपर है, this is the center of resistance. If it is above the center of resistance, it will bring about anti-clockwise movement. Below the center of resistance, will bring about clockwise movement. Next is face mask. It is for moving the maxilla forward. If the level of the force is adjusted by the level of this horizontal arm, if it is present below, it will bring about forward movement and anti-clockwise rotation of maxilla. If it is above, it will bring about forward movement and clockwise rotation of maxilla. The third one is chin cup. Chin cup is for stopping or preventing the growth of mandible. If mandible is growing excessively, again the force of direction. So the center of rotation of mandible is at the condyle. If the force of direction of force is below the condyle, it will cause pure rotation or rotation with anti-clockwise movement. And if it is in the line of condyle, it will cause pure rotation. Pure prevention of growth. If it is above the condyle, it will cause clockwise motion. So to conclude, I will be asking you these questions. You have to answer. What are orthopedic appliances? Anyone can answer.
We generate force to the bone.
Extraoral appliances applying heavy force to prevent, accelerate or redirect the growth of jaws in all the three dimensions of place. Why are they used? They are
They
used.
used to determine the size and shape position of the jaws.
Yes, they are used for maxilla and mandible to control or increase their growth. When can they be used?
They used in the condition retrognatic maxilla, prognatic maxilla, according to the case.
Okay, they can be used when the growth is remaining. When the growth is completed, they cannot be used. Which one to be used? It is decided by what type of malocclusion is present. If maxilla is placed forward, you want to prevent it or restrict it, you use a headgear. If maxilla is placed backward, you want to increase its growth or pull it forward, then you use a reverse pull headgear. And if the mandible is placed forward, to control it or to restrict its growth, you use a chin cup. And how are they used? There is a philosophy. You apply the appliance based on the type of movement you need, and you adjust them based on what type of restriction and movement you want to generate. If you want a clockwise motion, you take it below the resistance. If you want anti-clockwise movement, you take it above the resistance. But in the time which is limited, I have completed this chapter. If you have any further queries or doubts, you can mail me at this email ID. I will make a small video of your doubt and reply to your doubts. Or else you can ask me the doubt right. Any doubts?
No, sir.
Okay. Have a good day. If further also while studying the chapter you have any doubts, you can contact. Thank you.